So we live in north of Prescott, Arizona in Paulden. It's about 2.5 hours from here. And when I was 14, I had ingrown toes and had surgery on them. But where we live, there isn't any pediatric foot doctors. And so my wife was looking up the best options, and this is what came up. We watched the videos and saw the reviews of how good this place is and decided to schedule an appointment and come down here.
I've been having a lot of ingrown toes off and on. If we go to like we do a lot of vacation, and if we go to a theme park and I walk too long in closed-toed shoes, it gets a lot worse. But then even if I'm in flip-flops for months, it'll still kind of be there, but less bad. So it's just I feel like it's finally time to get it done, because I've had it since I was almost 10.
But we want to make it so that you don't feel pain. And so at this point, it should be that way where you only feel pressure. This is called paranachia. This is the enlargement of the nail. The nail kind of pushes over. These toes will just sit and fight each other. And that nail just causes that chronic irritation. It swells and then it just amplifies the pressure and discomfort. So we're just going to remove that little sliver and then make that sliver not grow back. And the aesthetic nature of the nail, it is kind of maintained. So we're just getting a piece of nail that's way down in there. Just like that. I'll pull this out. Roll that out. And so that's what we don't want in there.
Oh, how fascinating.
So that little chunk of nail creates, let's see, I'll pull this out too.
It felt like it pulled up.
But that little piece of nail, right, was way down in there. We'll get rid of that so it's not so crowded.
You just pulled out years and years of pain from her.
Yeah. So now, since that root has been exposed, we can put a chemical to keep that root from wanting to grow the nail. So then we'll use this to just kind of make the procedure a little
It
bit.
feels like, if you're inside of a rubber ball and someone hits it, a big one, and someone hits it, and you feel the vibration from the outside, but you don't actually feel it. It's like a shell around it. I don't feel it actually.
Yeah.
Or if you're a hamster in a hamster wheel and someone taps on it. It didn't actually feel like anything. I was really scared, but I didn't feel it, and it sounds like he added some extra stuff in the right one, and I didn't feel that at all.
So this iodine or providine gel is a great antiseptic. It will kill topical bacteria, but it also dries this out. We just find if you put Neosporin or a topical antibiotic, it macerates it. It puts a lot of moisture on here, and that moisture creates a lot of sensitivity. If you can put a drying agent on these, the sensitivity is significantly different.
It's like when you come out of a cave and now it's all bright.
They don't look so scary now, do they?
Because they're pink.
Yeah.